till 6 o'clock. And this next item that I wanted to share with you, I mentioned just a short while ago, it's the fight against COVID-19, which has brought together the world's greatest medical minds, with doctors and experts coming from all areas to help find ways to tackle the virus. Consultant paediatrician and infection specialist Stephen Owens, who trained at Liverpool's School of Tropical Medicine, well, he believes his experiences treating Ebola, diphtheria and measles in places like Sierra Leone and Samoa have been key in fighting the pandemic back home. And I'm delighted to say that Stephen is with us for Drive. Good evening, and thank you for joining us, Stephen.
Hello, Helen. Thanks for having me on.
It's a pleasure. Now, you started off here in Liverpool, trained at the School of Tropical Medicine. What took you to the likes of Sierra Leone and Samoa?
Well, through my time at Liverpool, I had a strong interest in international child health, and I was looking really for opportunities to develop that through the rest of my career. And I did a stint with the Medical Research Council in West Africa, doing research on early life infections and nutrition. And then when I completed my training and started as a consultant paediatrician, as I say, I was looking for opportunities really to continue with that sort of work. And as an infectious diseases specialist, the work of the charity UK Med and the British UK Emergency Medical Team offered the perfect opportunity really to do that.
And tell me about your experiences then and your time, Stephen, working as a medic abroad. What did that entail?
So back in 2014, I'm sure you'll remember the terrible West African Ebola outbreak.
Of course, yes.
In which Sierra Leone and Liberia and Guinea asked for help from the international community to help contain that huge epidemic. And the NHS at the time called out for volunteers to go and work overseas to help with that. And UK Med, which is a British-based emergency healthcare charity with an international outlook, was challenged really by the government to help provide trained staff from its register of members to help with that outbreak. And so I joined UK Med in order to go out to help with that, and remained with them ever since, really. Because the work complements my NHS work perfectly, and as I say, offers me the opportunity to continue with that sort of global element to my work.
And Stephen, of course, lots of us will have seen images on the television at the places that you've mentioned. I just wanted to ask you directly, because you've been there, what kind of conditions are the medical facilities in these countries?
Of course, it varies from country to country, really. So in Sierra Leone, that country had only fairly recently emerged from a catastrophic and prolonged civil war, and the healthcare infrastructure was only really starting to get back on its feet when Ebola hit. And it was a complete disaster, of course, and many of the sort of life-saving basic healthcare facilities, particularly for children and for pregnant women, were shut down. As the country sort of pivoted and tried to focus on containing this awful infectious disease outbreak. So we went to work in designated Ebola treatment centres where we were only providing care for Ebola patients, children and adults, in this huge facility just outside Carytown, along with volunteers from the Sierra Leonean healthcare agencies, as well as international volunteers. And then later, when there was a big diphtheria outbreak among Rohingya refugees in Bangladesh, again, we were tasked to provide specialist care only for diphtheria patients, but within Cox's Bazar refugee camp. So a very different sort of setup, with much smaller teams involved, with their work sort of disseminated throughout this huge refugee camp. And then latterly in Samoa, in 2019, we joined existing clinics and hospitals in Samoa to sort of augment the national healthcare staff in providing care for measles patients. So we were working within fairly well-equipped and well-resourced hospitals that had just effectively been overwhelmed, really, by one infectious disease, in a way that paralleled what was to happen soon afterwards.
bringing it back to kind of full circle, because you've discussed there the diseases that you were treating, and you believe that this whole experience that has been vital in your work in the UK during the pandemic. How do you think, Stephen, it's equipped you with the skills to kind of face this new challenge, this new area of medical insight that you've had to kind of step in with?
Yeah, I mean, it's not just me. So UK Med have just recently conducted a huge survey of its membership and focus group interviews and discussions with members who have deployed, really trying to assess the impact of their deployments on their NHS practice when they came back home. And they looked at questions across 7 domains, looking at leadership and resilience and clinical skills and quality improvement and so on, to really find huge positive impacts reported from membership on their NHS practice back home in all of these kind of domains, really. In my case, as an infectious diseases doctor, particularly in Newcastle, which is one of the small select group of units across the country which looks after patients with what are called high consequence infectious diseases. So these are very virulent or transmissible infections which are cared for in specialist isolation facilities. So going abroad and seeing these infections and managing them in the field gives me invaluable direct clinical experience in the conditions that I need to be ready to deal with, back in the UK, should those patients arrive on our doorstep. And of course, in this globalised world that we live in, that can happen. You very easily now you can travel between any 2 points on the surface of the globe within 48 hours or so. And so those sort of rare infections and exotic, esoteric conditions that we read about as students and perhaps forgotten about can nowadays turn up anywhere and any time, and we need to have clinicians who've got the experience managing them in place in our own hospitals to do that properly here, and that fits very well with my NHS practice and complements it very perfectly, really.
And so take us back then to that first moment when the first COVID patient was admitted, because you're now based in Newcastle, and that's right, where the first patient was admitted. Your first thoughts, if you can take us back, was there anything that you'd come across before?
Well, so I was well used to dealing with respiratory pathogens, and as I say, having trained as a consultant in Newcastle in this high consequence infectious diseases unit, I was used to working in high levels of personal protective equipment, PPE, and so when the first patients with COVID started to turn up here, the cases were managed in centres like Newcastle. In fact, I think Newcastle was the first hospital to admit patients with COVID-19 within the NHS. And so for me, it was business as usual. As I say, the experience that I'd had overseas, particularly with Ebola, meant that I guess it perhaps didn't faze me in the way that it might have done if I'd not had that experience before. And so as I say, dealing with the equipment, dealing with scared and frightened patients with a new infection, which at the time, quite rightly, everyone was absolutely terrified of. The previous experience I'd had, I hope, allowed me to do that more effectively and more efficiently. Of course, as time went on and the number of cases increased so dramatically, it was no longer possible to care for all the patients in these specialised units. And those skills had to be transferred across all of the NHS, really. And I think those of us with international experience, many of us had teaching and training roles that we then took on to try to get all of our teams up and running and, been able to rise to that challenge. And hopefully that was a successful thing. And, I think the NHS has done an incredible job under extremely trying conditions right across the country.
Of course, and again, with that backstory that you've kind of kindly updated us on, I'm sure that made all the difference as well. And maybe you had to just think on your feet and you acted maybe differently and treated the patients differently. If you hadn't maybe had those experiences, do you think it was the right journey, as in you were meant to be a part of that team, Stephen?
Yeah, I mean, as I say, it's the broad interest in global health and infectious diseases led me to pursue opportunities in my training overseas, and as you said, equipped me certainly with knowledge and experience of similar conditions, which when I came back meant that as you say, it felt like perhaps I was in the right place at the right time to do that. And it's not just me. As I say, the UK Med is a charity which holds a register of something like 580 predominantly UK NHS-based health professionals crossing all the spheres, all the specialties, who have this interest, have this global outlook, understand that in today's society and the kind of medical world in which we live, we have to keep an eye on what's happening with our neighbours across the world, because these infections, they don't observe national borders. It's been an observation oft quoted that the only way to contain them effectively is by making sure that the countries where the infections arise are supported and resourced by those countries with perhaps greater access to those resources in order to help them manage them locally and prevent them spreading around the world. So UK Med is really at the forefront of that, and works very closely with our government in the UK emergency medical team to deploy all over the world at a moment's notice, really, with expert clinical teams to help manage those problems, those outbreaks in the field, and then they bring that experience back to the UK for everyone's benefit. It's a win-win situation, I think, for everybody.
Well, wonderful getting the catch-up from you, Stephen. Many thanks for your time tonight here on Drive. It's been a pleasure to catch up.
Likewise. Thanks very much for having me.
Thank you. That is a consultant paediatrician and infection specialist, Stephen Owens, who trained at the Liverpool School of Tropical Medicine, now working at Newcastle's Children's Hospital. And what a great story.